That one I like for
All right, what would you do
infundibulocystic
with this?
BTC. You can see kind of the pink strand and blue bud appearance.
Yeah, that's a good point. So it's a basaloid tumor, but it's got little cysts filled with keratin, and it's got this very funny kind of um, antler-like staghorn. I don't know what name you like for it. Pattern that instantly gives me the feeling of, oh, could this be a hair follicle tumor? Right? These little nests that are branching out, and it doesn't have much in the way of mucin or clefting or that mucin-rich stroma. So I definitely would be thinking of a hair follicle tumor here. So I think you could think of this two ways. If I just see a small area that looks like this, like around a hair follicle, then I would usually call it a basaloid follicular hamartoma. But this one is pretty big and is infiltrating down. I mean, it's pushing down into skeletal muscle. Now I know we're on the face here, but I mean, when I see that in an older sun damaged person and it's pushing way down, I'm usually going to end up calling that basal cell carcinoma, or at least saying I'm suspicious. So when you see something that looks like that you decide is a basal cell carcinoma, but it really looks kind of follicular, some people call those infundibulocystic basal cell carcinoma, or you could say basal cell carcinoma with follicular differentiation. And one thing that I will do sometimes in these, if I'm between the two, is do a cytokeratin 20, which in benign hair follicle proliferations, a lot of times you'll have scattered benign Merkel cells, like passenger Merkel cells dotted throughout the lesion. And in basal cell carcinomas, you tend to lose those. And there's a variety of other stains people have done to try to tell apart basal cell carcinoma from basaloid proliferations like benign hair follicle tumors. And I feel like a lot of those are kind of challenging to use. And the reason people have described so many is because none of them are totally perfect. But here, based on that infiltration down here and this pushing way down, I would say this is, yeah, basal cell carcinoma, infundibulocystic type. A lot of times I just actually will call these nodular type in my pathology report in case the treating physician is not familiar with this term, infundibulocystic, which sounds a little bit more, kind of wordy, but doesn't, to me, these are basically like a low risk form of basal cell, just like a nodular type, not the aggressive type. All right, so that's a good example.